Welcome to Oncology Podcast News. I'm your host, Ellen Baker. This week's top stories include cancer among young adults is on a rise. Prostate cancer patients see high survival rates with seed implants. And new biomarker test could predict outcome for bladder cancer patients. The American Cancer Society, in its recent report, says that cancers like colorectal, thyroid, and testicular cancers are rising among young adults who are under 40 years of age. Now, a research is being conducted by Dr. Karen Albertune, Director of Adolescent and Young Adult Oncology at Boston's Dana-Farber Cancer Institute, for determining the reasons for the rise of cancers among young people. The National Cancer Institute and Lance Armstrong Foundation have reported that survival rates for cancer among young adults have not significantly improved in 20 years. Cancer is the fourth leading cause of death in young people, next to trailing accidents, suicides, and homicides. The young women who have been diagnosed with breast cancer, a tumor may be estrogen stimulated, where physicians might recommend blocking the patient's menstruation after chemotherapy treatment or even removing the ovaries. But as young women are still in childbearing years, it is difficult to take this decision. In young men, testicular cancer is on the rise, and the reason is not yet determined. Thyroid cancer is another puzzle, as the only known cause of this type of cancer is radiation. Most of the problems arising among this age group are rather emotional, mental, and financial issues. Most of them do not even carry health insurance. Dealing with severe physical changes at a time when health and physical characteristics should be at a peak. Guilty feelings of becoming a burden to their family are some of the depressing and devastating factors that cancer victims are facing. More than 90% of men who receive appropriate radiation dose levels with permanent radiation seed implants to treat their prostate cancer are cured of their cancer 8 years after diagnosis, according to a study released in the February 1st issue of the International Journal for Radiation Oncology Biology Physics, the official journal of ASTRO. Seed implants have become a widely accepted treatment option for early-stage prostate cancer because it is very effective at curing the cancer, is minimally invasive, and often spares patients from side effects of other treatments, such as impotence and incontinence. The seeds, similar in size to a grain of rice, contain a radiation dose that, once implanted, delivers concentrated radiation to the prostate's sparing surrounding organs and tissue. Doctors in this study evaluated the long-term results of permanent seed implants in men with early-stage prostate cancer. Nearly 2,700 men were studied at 11 institutions in the United States over 8 years. The radioactive seeds were administered with the aid of ultrasound-guided techniques to accurately place the seeds in the prostate gland. The patients received the seed implants as the sole treatment for prostate cancer, with no additional chemotherapy or radiation therapy. A set of molecular biomarkers might better predict the recurrence of bladder cancer than conventional prognostic features such as the stage or grade of the malignancy at the time it is discovered, UT Southwestern Medical Center researchers have found. Once a patient undergoes surgery for the removal of their bladder and lymph nodes, the standard treatment for muscle-invasive bladder cancer, researchers say a routine tissue analysis could easily test for the presence of mutated proteins, or biomarkers, that they have found to help ascertain the chances that the cancer will return. The findings, which researchers say could one day alter the postoperative treatment offered to patients who test positive for mutated biomarkers, are available online and in an upcoming issue of the Lancet Oncology. Researchers collected archival tissue from 226 patients who underwent surgery for bladder cancer, the fourth most common cancer in men and the ninth most common cancer in women, between January 1987 and December 2002. They tested the tissue for the protein biomarkers and found that the patients who showed mutations in all 4 biomarkers had a significantly increased rate of mortality from cancer after surgery. Patients who showed no mutations in the 4 biomarkers had a 90% chance of survival at 5 years, compared to less than 20% if they had 4 mutated markers. Dr. Sharok Sharayat, the study's senior author and a urology resident at UT Southwestern, said the findings suggest that mutations in the biomarkers indicate a malfunction in programmed cell death, leading to increased chances of cancer recurrence and mortality. Thanks for listening for Oncology Podcasting. This is Ellen Baker.